We are happy to meet you once again Saturday. This Saturday we are very happy because we are able to finish 1603 cases of Puberphonia. So every week patients are coming for Puberphonia treatment with us. We got lot of message from in and around India. All are excited. Even one patient is coming next week from Dubai. So we'll be happy treating all the cases. In our hand, God is very grateful to us because almost most of the cases we are able to succeed in treating the Puberphonia boys. Along that, we are treating paralysis of the vocal cord. We are treating different type of voices in paralysis, deaf, complete deaf people and old people who are having problem with clarity of speech. Especially this week, two teachers we are giving treatment. I am happy to tell you some of these cases, they are friendly approaching us so that we are not charging anything for them. Definitely, we'll charge all the Puberphonia boys 10,000 rupees for 5 days treatment. And if they are coming from outstation, we give accommodation 300 rupees per day, but food should be from outside. We request all who are having Puberphonia contact us. We'll try to do it in a adjustable methods which help them. And poor boy, we are able to extend all our help to treat them. Now, today I just thought the very important thing in Puberphonia treatment is the pitch, high pitch or low pitch. Our own finding is redirect phonation from larynx to pharynx. If you want to treat Puberphonia in any method, how you achieve the low pitch voice is only pharyngeal voice. This is our strong belief and strong finding. I am so happy to tell you laryngeal voice, pharyngeal voice, oral voice, lip voice, in different places voice are produced. Nobody can say only the larynx produce, that is the voice box, it produces voice. No. Yes, it also produces, but it is helped by pharynx, nose, mouth, lip to produce sound. Even the lip can produce a voice, different type. Tongue can produce. Whistling is done exclusively by tongue. Snoring, cough, that sounds are created by the uvula. We know that voice box could produce most of the sound. See, all these in combination produce the sound. High pitch sound is created at the level of the vocal cord, which is modified in different pitches. So our speech pitch is in different type, but in female the predominantly vocal cord, so it is a high pitch. In male it is predominantly pharyngeal voice, so it is low pitch. Resonating chambers are there in the nose and sinus, buccal cavity. Modulate the voice in different manner and we get it. So whether surgery or physiotherapy or speech therapy or voice modulation, all these things, our finding is you have to change the laryngeal voice to pharyngeal voice. So the puberphonia means it is a mutational falsetto, which is a voice disorder where a person maintains a high pitched voice beyond the typical age of the voice change during the puberty. Instead of having a deep adult male voice, puberphonia boys continue to use high pitched voice. Because of the high pitched voice lacking or high pitched voice, they continue without their intention. It is intentionally done when they are singing. Singing means we need high pitch, high pitch. We like high pitch. So they try to modulate the voice and which will become more breathy and rough voice. Puberphonia boys are emotionally also disturbed. So that will impact their social life. That is what we are more concentrated, we are going on telling. So now only the world is slowly recognizing the puberphonia. We have to treat it as early as possible because it won't cure automatically. The puberphonia will never become normal automatically. Everybody feels that during puberty, the voice box, so-called larynx, grows, vocal cord thicken, which lead to the lower pitch voice in males. Yes, but in puberphonia, male vocal cords are thick, vocal cords are grown, but still their voice is not low pitch. Still books are going on writing. Something wrong with the larynx vocal cord. So puberphonia means voice only different, but the structure is normal like that of a adult male. Vocal cords grown, length, thick, everything is similar to adult male who are having low pitch voice, but the voice is low. This going on repeating in my mind, that's all. Puberphonia, there is a persistent of high pitch voice in spite of normal vocal cord. So there is no question of any changing the size of the vocal cord, thickness of the vocal cord, or a manipulation in the vocal cord. Nothing is going to happen because they are having the normal adult male vocal cord. So the voice of a puberphonia is typically described as high-pitched, breathy, lack in power, which may have pitch break. Lack in power, the power is less. That is what I am very much interested. Before that, they say it is tense, all the things. No, everybody accepts that puberphonia larynx is not under tension. They have no power. They are not interested in talking. Still, the possible cause of puberphonia, we are very sure intentionally and unintentionally it continues. Intentionally continue means they want to sing like a lady. People like that, father like that, mother like that, teachers like that. Their life, their income is in the high pitched voice. So they continue it. So the popular recognized cause for puberphonia. See, in puberphonia is the larynx is normal, but they say muscle tension in the larynx and neck. These are all only imaginary. It is not there at all. They are having lacy larynx, lacy neck. So where is the question of muscle tension? They are having psychological upset. They never want to accept the new voice. Psychological upset happen because of the voice change. Voice doesn't change. This psychological factor never cause it. Yes, they habitually continue the high pitch voice even after puberty. That is what the impact of the individual, social embarrassment in and isolation. Try to understand it has to be treated as early as possible, or else what will happen to the boy? Mothers, fathers, teachers, friends, well-wishers, they wait, and spoil the life. So, yes, self-embracement and social isolation will happen. They are having difficulties in communication in various settings, impact on self-esteem and confidence. So the voice should be treated as early as possible. The puberphonia, so even though it is not yet life-threatening disease, but life become isolation. How can you continue your life with a isolated setup? You may say it is a psychological or functional, all the things, but try to treat it as early as possible. The puberphonia should be treated very early. So don't say it is a functional disorder and leave it. See, we have to understand there are a lot of changes that comes with the puberty. One start to develop the secondary sexual characteristics, hair growth. When child it is not there, stronger emotion to few feelings. The voice also change to deeper. So this is very significant in younger boys' life. If it doesn't happen, it can cause more concern. You have to think twice. Teenage girls, women who have high pitched voice, but it is different in teenage boys. If you are now one is not having the voice drop, psychologically troubling the teen boys. So they say it is a functional falsetto. Immediately we have to treat it, or else it will go for a tragic problems. During puberty, all male gender experience a drop in the pitch of the voices. Deeper in teen boys, the voice drop by 1 octave on average. See, all these octave and other things are still suggest that voice change is art, not science. But is it happening in girls? Yes, girls also little change, but they say it is a few semitones. So when the drop of pitch fail to happen, we call as puberphonia. So puberphonia is classified as a voice disorder. Voice disorder happen when something about your voice, your pitch or quality, which does not match factors about you, your gender and age. So every people should know what is puberphonia. High pitch voice and the voice usually measured in hertz. It is 120 hertz for men and 210 average for women. High pitch 210. So your pitch should not go beyond 120 hertz. So you have to measure your pitch. That is the only test required. No other test. He is a male. He is having good health. That's all. If anatomically changes, it is the diagnosis is different. If it is psychologically, it is different. If it is hormonally, it is different. It is not puberphonia at all. If you say puberphonia, the larynx should be normal. So the first and only test required is assessment of pitch. No blood test, nothing is required. No other examination also required. So try to understand, in male is average about 120, and female it is 210 hertz. Because of this voice change in male, puberphonia voice may be hoarse, lower intensity, trouble to make your voice more louder, become tired when speaking for a long period, decrease vocal endurance, increase effort to speak, fluctuation in voice quality. These things can produce a tension in the neck or throat, but usually they will become tired. They think their life is like that. So they never try to correct their voice. So what is the cause for the puberphonia? Voice order, such as puberphonia, can psychological, neurological, biological. A problem in the larynx, voice box. Biological causes, they say tension in the laryngeal muscle, anomalies of the larynx, hearing impaired, thyroid cartilage problem, vocal cord paralysis, lack of muscle coordination, vocal cord polyp, cysts, nodules, trauma to the larynx, asymmetry of the vocal cord, inflammation of the larynx. These all the biological causes they include. But pure puberphonia, nothing will be like that. If it is there is a problem in the vocal cord, the diagnosis is different. polyp, cyst, nodule. They can have puberphonic voice, but they are not puberphonia boys. Thyroid cartilage not fused together. They can have a puberphonic voice, but they are not puberphonia. Hearing impairment can have a high pitch voice, but they are not puberphonia boys. The voice may be high pitch in hearing loss with hearing impairment. Their voice may be high pitch, but they are not puberphonia boys. Any anomalies in the larynx, any anomalies in the by birth in the larynx, they can have high pitch voice, but they are not puberphonic voice. Try to understand. A tension in the larynx can produce puberphonic voice, but they are not puberphonia voice. So they say these are the conditions for neurological, biological causes. Then neurological causes. These are all interested in reading. Parkinsonism, multiple sclerosis, laryngeal nerve paralysis, vocal cord spasm. Parkinsonism, multiple sclerosis, laryngeal nerve paralysis, vocal cord spasm can have a high pitch voice, but they are not puberphonia boys. Then, lastly, psychological factors. Puberphonia boys may experience a resistance to change, which happens, which comes in puberty. They are resistant, they say. Stress, emotional stress, depression, anxiety, self-conscious. So puberty, why I am going in these changes? They say the psychological causes can cause a puberphonia. But puberphonia causes these psychological problems, not these psychological problems produce puberphonia. Very difficult to understand. Psychological causes associated with puberphonia is there. Okay, I'm accepting. But these psychological causes never cause puberphonia. Puberphonia causes psychological problems. This is very difficult to digest, but this is what my experience says. Whatever the therapy we are now contemplating, the direct voice therapy or indirect voice therapy, all these things changes the laryngeal voice to pharyngeal voice. That's what going to happen. So direct voice therapy. What is the direct voice therapy? If you cough, do humming, your voice will become normal, low pitch. But maintenance should be there. That is what we are doing in Umar therapy. Puberphonia boys, when they hum, when they cough, they will have a normal low pitch voice. The most common way of puberphonia treatment is through vocal exercise, they say. If you cough, if you snore, you can have a high pitch voice change to low pitch voice. This is the direct voice therapy. Yes, voice is changed. But how to maintain it? How cough produces a transitional change of high pitch to low pitch voice. Cough is there. Predominantly the organ involved is mouth and pharynx, not larynx at all. That we have to understand. Snoring, a direct voice therapy. Immediately the high pitch voice is changed to low pitch voice. But which organ is operating for snoring? Pharynx. Larynx is having a small play only. So until now, the olden theory is you have to understand the vocal cord function. That is what produces the fundamental pitch. So everything depends upon the vocal cord. Vocal cord produces sound. Pharyngeal tissue produces sound. Tongue produces sound. Lip produces sound. So pitch can be produced, altered in any place. See, the articulators can produce sound. Little more idea is there. Some of the tissue in the mouth or pharynx, whether it is a passive articulator or active articulator, still the doubts is going on. Even with EULA, some says it is an active articulator, some says it is a passive articulator. So I think it is an active articulator and passive articulator. That's all. Direct voice therapy is very simple. Cough produces changes high pitch to low pitch. In coughing, where is the sound created? Where is the pitch created? Predominantly in the pharynx, not in the larynx. When you cough, oh, 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 oh. When you snore, oh, 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 oh. Where the predominantly the pitch is produced, the voice is produced, not in the larynx, but in the pharynx. This is what my interest. Redirected phonation treat puberphonia. In puberphonia, if you want to treat it, any method, even surgery in the larynx, what happened, the final thing, what happened is laryngeal voice is converted into pharyngeal voice. I am not saying that larynx is not working. Yes, it is also helping. But where the predominantly the voice is coming. So this is a direct voice therapy. Directly give and create some words with low pitch while coughing, snoring, or humming. So this is a direct voice therapy. They say with half swallowing technique also. Yes, there are some things we can do. What is the indirect voice therapy? So it can be done with the direct voice therapy also. The indirect voice therapy is, some says it is more effective. This include counseling to identify the psychological factor contributing to puberphonia and help address these issues. Indirect voice therapy include education of good vocal hygiene and education of how certain action could affect your voice. So indirect way also we can treat the voice. The third thing is audio visual feedback. So whatever may be, how to treat puberphonia means The pitch of the high pitch voice should be changed to low pitch. High pitch is produced by the vocal cord. Low pitch is generated at the level of the pharynx, even the mouth. So redirected phonation treat puberphonia. So we are so happy to meet this Saturday, 2nd August 2025. We have completed 1,603 cases of puberphonia. Every day our research is going on. We are doing a lot of research in Siva ENT Hospital in measuring the frequency for each and every individual. Thank you. Great. We'll meet in the next Saturday, same time, 5 to 5:30. Thank you. Thank you. Thank you. Great.